So many of our patients ask like what they can do at home in their daily life to make things easier for them if they're diagnosed with this condition. And I think it's important to just really pace yourself because if you have an autoimmune muscle disease, we need to treat it first. And so you're not going to get back to your usual self immediately, and it could take potentially months or even years to feel really back to yourself. But that is possible. That's why I tell my patients, with treatment, with a healthy lifestyle, and moderate exercise that's tailored to you and to your muscle condition, I think it's all reversible potentially. But we have to diagnose you early, and we have to see you early so that we can maximize that potential. So I believe physical therapy and exercise is very important in our patients with Scleroderma Associated Muscle Disease, or even in general with myositis, anybody who has a muscle disease. I think the old thought and old teaching is that, okay, if you have muscle disease, why would you exercise more? Because that'll put more stress on your muscles. But in reality, there's a lot of data now and a lot of studies showing that exercise can be very beneficial. So one aspect of the muscle disease is you want to treat with immunosuppressive agents and treat the inflammation if there is inflammation. But if you're just being treated with immunosuppression and you're just not moving your muscles and you're not providing oxygen to those muscles by exercising, then I think that defeats the purpose almost. With the right treatment, if you're able to do a little more, just pushing yourself a little bit to do more is important. Now, if you can't, then we have to figure out why that's the case. Is it because we're not treating you aggressively enough? Or is there another process going on that we need to figure out? So it's important to communicate to your doctor what exactly is going on if you really can't do things, your activities that you used to do. So you want to kind of do hand in hand, but want to have a physical therapy program that's very suited to your disease process. And so I think it's very important to work closely with the physical therapist and adopt a very specific exercise plan that would be beneficial for patients with even myositis or even Scleroderma Associated Muscle Disease.